Okay, you can go ahead.
Welcome, everybody, for our webinar series organized by the Prince Takamado Japan Center for Teaching and Research, Faculty of Arts at University of Alberta, and sponsored by the Consul General of Japan in Calgary. This is the first of our dialogue of our series, COVID-19 Policies in Japan and Canada. My name is Fujiwara. I'm the director of Prince Takamado Japan Center. From Japan, here with us today, Dr. Hitoshi Oshitani, Professor of Virology at Tohoku University. He's also currently the member of Novel Coronavirus Expert Committee for Government of Alberta, Government of Japan. Thank you, Professor, for being with us. And from Alberta, Canada, we have invited Dr. Deena Hinshaw, Chief Medical Officer of Health Government of Alberta, but she's currently attending another meeting and there have been a little bit of delay, and I hope that she can join us very soon. But we are very lucky to have two people who are currently busiest and best known people in Japan and Canada. We are also very honored to have Mr. Shigenobu Kobayashi, Consul General of Japan in Calgary, here with us today. We also invited a student guest, Sarah Clifford, who has just completed her BA in political science at University of Alberta. She's moving on to her graduate studies in Denmark. Thank you, Sarah, for being with us, and congratulations.
Thank you.
Now I'd like to invite Consul General Kobayashi for greetings. Consul General, please.
You are muted. You're muted.
Can you hear me? Okay, thank you, Aya-san. To our speakers and the viewers in Japan, good morning. And to those in Canada, good evening. First, I would like to express my deepest condolence to the patient and the sufferers caused by COVID-19 and the recent torrential rain in Japan. I wish a normal or a new normal day comes soon. Today, on behalf of the Ministry of Foreign Affairs of Japan, it is my honor to be a part of discussion on aging society in the era of pandemics, approaches in Japan and Canada. The Ministry is pleased to provide a sponsorship to an important webinar. Through the collaboration of our both nations' experts, we will gain the insight to help deal with our common struggles. Not only our two nations face, but the entire world face these struggles. I would like to thank the event hosting institution, the Prince Takamado Japan Center for Teaching and Research, University of Alberta, Dr. Aya Fujiwara, the director. They are identifying the necessity of joint discussion on this topic and finally realize this event. I would of course like to extend my utmost appreciation to both leading experts joining us today. From Japan, Dr. Hitoshi Oshitani, Professor of Virology at Tohoku University Graduate School of Medicine. He's a member of the government of Japan's new corona antivirus subcommittee. I met him about 5 years ago on Ebola virus infection. He was sent at that time West Africa, while I was emergency relief coordinator in Tokyo. He has a quite long career. From Canada, Dr. Deena Hinshaw, the Chief Medical Officer of Health from the government of Alberta, who is heading the provincial path to recovery from the pandemic. To our viewers, whether you join us for reason of interest in public health or demographic context or our nation's future, I thank you all for your involvement in this exchange of views. In particular, to younger audience, I want to urge you to continue to stay this new development and persist in learning from the experience over the pandemic. One might say, despite the tragedy, but rather it is because of it, because it poses such a catastrophic potential to all humanity, we have the more reason to face it head on. When you meet a similar daunting obstacle in the future, the young generation, the youth, you will be a wellspring of idea and innovation. You are leading us forward. It has become glaringly clear that we no longer stand alone as a people, nations, or even as a broader geographic regions. This is a global problem. The difficulty posed by the pandemic of this scale is monumental. In the midst of the shift toward aging society for many countries, including Canada and Japan, we can take advantage of this pandemic to consider how to handle our aging societies. We are today to listen carefully to each other, a chance to learn how we may be of service to the rest of the community, rest of the humanity for the future. We will never forget this tragedy. So many of us left behind are tired. So many of us are sick. So many of us feel desperate. However, this is where we can only shine together. This is where our losses solidify into resolve. This is where we will go forward. I trust that today's exchange of ideas will bring us one step closer to that future. Through this kind of the collaborative approach to problem solving, we will eventually find our path to a remedy. The Ministry of Foreign Affairs of Japan is pleased to cooperate with the provincial government of Alberta, University of Alberta, and other organizations for further consideration. Thank you very much.
Hello.
Thank you very much. Thank you very much, Consul General Kobayashi. And do we have Dr. Deena Hinshaw? Welcome. Thank you very much for joining us. And I want to introduce once again from Alberta, Canada, we have Dr. Deena Hinshaw, Chief Medical Officer of Health Government of Alberta. Thank you very much for joining us.
I am so sorry for being late. I was trying to join and the link wasn't connecting, and so I had to do some technical, get some technical backup. So I apologize for being late.
Yes, we are very honored to have you here. So this is my first question to Dr. Oshitani and Dr. Hinshaw. So while we should not forget the fact that many lives have been lost in this pandemic, and my thoughts are with their families and friends, but both Japan and Alberta have managed to flatten the curve, minimizing the number of deaths so far. Could you tell us what sort of policies your team has adopted? So first of all, let's start with Dr. Oshitani, please.
Thank you very much, Dr. Fujiwara, for introduction. And it's my great honor and great pleasure to be at this webinar to share our experience in Japan with our colleagues in Alberta. And first, I'd like to give the brief overview of COVID-19 situation in Japan. Our very first case was identified on the 15th of January, and then number of cases increased from the end of March. And the government declared the state of emergency on the 7th of April because of the increasing number of cases. But the state of the emergency was lifted on the 25th of May. And as of yesterday, we have 21,459 cases with the 981 deaths in Japan. Although we lost many lives due to COVID-19, our mortality impact is smaller than other countries. And there might be many reasons why we are having the lower mortality impact, including currently unknown reasons. But our approach for COVID-19 is quite unique and different from other countries. I will show some slides and to explain our approach And I hope you can see my slide. And in early stage of outbreak, we found that this virus, the SARS-CoV-2, is transmitted in a very peculiar way. The most of cases do not pass the virus to others, but the very small portion of infected individual infect many others, and creating the clusters or the super spreading event. So our approach is focusing on reducing the clusters, and but we need to identify the clusters, and we are using the quite unique approach for the contact tracing. In many other countries, they are doing a so-called prospective contact tracing. That when you identify the infected individual, you also identify the contacts of that individual and follow these contacts. And we are also doing this prospective contact tracing. But in addition to prospective contact tracing, we are also doing the retrospective tracing. Meaning that when you have identified cases, we try to identify the common source, which is likely to be the cluster or super spreading event. By doing this approach, we managed to identify many clusters, and we also managed to interrupt the transmission from the clusters. And because we believe that it's very important to interrupt cluster to cluster the transmission. So, and the asset of the cluster approach is that we could identify common characteristics of clusters. We have identified more than 200 clusters in Japan, and the important common characteristics of the cluster include these 3 C's: the closed environment, the crowded environment, and the close contact settings. And these 3 C's are most important environmental settings where the most clusters have been occurring. And this 3 C's concept, the sanmitsu in Japanese, it's very the familiar in the Japanese people. Even small kids know this notion of the 3 C's, and we managed to send the more effective public health message to the general public to avoid such risky environment. And this slide shows the current the situation in Japan. Now, after the state of emergency was lifted, the number of cases is gradually increasing, especially in Japan, in Tokyo. And most of these cases are associated with the nightlife entertainment setting, and which is quite difficult to trace the contact. Because the majority of people in these settings are young, they do not develop severe symptoms. Most of them are just developing the mild or even asymptomatic. They do not show any symptom. So the contact tracing is difficult. And also some people do not tell where they were, if they visited such settings or not. So it's also socially difficult to do the contact tracing. But in the current phase of outbreak in Japan, the most of the cases are young people, and we do not during the initial outbreak, from March to May, we had many outbreaks in hospital settings and also the nursing home settings. And nearly half of deaths occurred in these settings. And our main objective now is to the reduce the number of outbreaks in these settings. And currently, although number is increasing in Tokyo, the more than 30% of cases are in their 20s or 30s. Most of them are young people. And we don't see any nursing home outbreaks, except one in Tokyo. And we managed to interrupt the transmission to the hospital and the nursing homes. But we are now trying to introduce the new technologies to interrupt the transmission chain, especially the transmission to the hospital and nursing homes. And we are planning to do more proactive testing not only in nightlife settings, but also in hospital and the nursing homes, so that we can minimize the number of outbreaks in these settings. And we're also using the supercomputer to simulate the transmission pattern, or in the crowded places, how the droplet and the small particles can cause the transmission in these settings. By using the supercomputer, we are simulating the mode of transmission, and I hope we can suppress the transmission more effectively in coming the weeks or months. And I'm sure the transmission will continue, and I don't think this virus will go away in the next months or the years. So we have to live together with this virus, and we need to develop more effective control measure to minimize the impact of this virus. And that's all. Thank you very much for your attention.
Thank you very much, Dr. Oshitani. And so, Dr. Hinshaw, could you tell us about Alberta proceeds?
Sure, and thank you for that. That was really interesting. I'm sorry that I didn't prepare slides for this, but I can give you a bit of an overview. And it's interesting to see your epidemic curve because it's almost identical to ours in terms of the shape, although the total numbers are a little bit different given the difference in our populations. But the first case we had was the beginning of March, and we progressed quite quickly within the next couple of weeks to declaring a state of public health emergency here. And that state of public health emergency persisted until the middle of June. So we had a longer declaration of that state of public health emergency. But we did start lifting our restrictions as early as the beginning of May. So our peak was in the end of April, and we, like you, saw the majority of our deaths, so 75% of our deaths were in long-term care facilities. And in our deaths overall, the majority have been in those who are older. We have had a few younger cases. So we did have a death in someone in their 20s and a death in someone in their 30s and then their 40s. So we have had a very small number of younger people who passed away from the virus, very sadly. And of course, it's sad when older people pass away as well. But that has been a similar type of epidemiology that you shared to what we have seen with respect to the majority of cases that we had in the beginning of our epidemic experience, of our pandemic experience, were returning travelers. So almost all of the cases that we had in early to mid-March were those who were traveling back from other countries. 30% of our cases, of our travel-related cases, came into us from the United States. So that's also been interesting because we had actually very few cases come to us directly traveling from China, very small number. And then we ended up having more cases coming to us from Europe, coming from the United States. That was really the majority of our initial cases. And then once, unfortunately, we did have the virus become established and start to circulate in the population, we saw several significant outbreaks in workplaces that were associated with outbreaks such as meat packing plants, where there's quite crowded work environments where there's lots of noise, so people are shouting to be heard above the noise, and the virus transmitted very efficiently in those settings. And not only that, there were many workers in those settings who were living in accommodations where there were many people living in the same house, so quite crowded accommodations. So the point that you made about how COVID spreads in clusters, we saw amplification not just in the workplace, but amplification outside the workplace in the household setting. And it kind of moved back and forth and in those settings. And we ended up having very large outbreaks, thousands of cases from a couple of specific locations where transmission occurred. We also had many outbreaks in long-term care settings at that time. And so that's where we had a bit of an older age average in our cases. We ended up having a decline then in our cases. And the interesting thing, you mentioned the tail end of your curve where it's starting to move up again. And we're seeing something similar. And again, similar age group, 55% of our cases are in people under the age of 40 right now. And a lot of the cases are in people who are spending time together socializing in restaurants or bars, spending time together in social settings in each other's homes. And so that's really what we're trying to combat now, is trying to help people understand that when they make decisions about risk, they're not making it just for themselves, but for other people as well. And so if someone's choosing to take on a risky behavior, they could potentially also be putting others at risk if they don't think about who they're coming in contact with. So we've had, for example, workers who work at long-term care facilities who are younger, but then unfortunately end up putting those people who they care for at risk. We have instituted some policies in long-term care facilities, such as masking of all staff, of all those who are in the facility working for the duration of their shifts. We've limited visitors in those facilities in order to limit the potential for introduction of the virus. We've taken measures such as having staff work at only one long-term care facility and not be able to move between different facilities. And some of these measures have had a significant impact. So, for example, visiting restrictions have had a big impact on loneliness and isolation of those who live in the facility. So we're really wrestling with wanting to give back more ability to visit, to provide supports for mental health, social connection, but at the same time, keeping enough restrictions so that we're keeping people in those facilities safe. And that's a big area of focus right now, working on that policy. We're also trying to overcome the challenge of people not having had personal experience with how severe COVID can be. And so there's certainly a segment of our population that's not taking restrictions very seriously right now and feeling like our response to COVID has been overblown. And so people are not following public health orders. The 3 C's that you mentioned are a great summary of the key public health measures. We're also recommending masking of the public when they're out, especially when they're in indoor spaces with others outside their household. And we're seeing certainly a proportion of the population is taking that message seriously and using their good judgment to avoid those kinds of things. But there is a proportion of the population that either doesn't believe that COVID is real, thinks that it's a very mild illness and that we've overreacted. So we're really struggling with our messaging around that to try to remind people that COVID is a novel virus, and that even though people who are older with chronic illnesses are most at risk of severe outcomes, even younger people can sometimes have very severe disease, and in the worst cases, even younger people who are previously healthy can die of this disease. And that is not, I think, believed by all members of our public. So we're working hard to get that messaging out, to remind people of all of those basic practices that they can do to protect themselves and others. And unfortunately, we are seeing a bit of a resurgence right now, similar to what you've mentioned that you're seeing in Tokyo particularly. So I don't know if there's any specific questions that you have for me. I would be really interested in knowing how you've managed balancing some of these tensions between allowing people freedom to have more social connections, spend more time together, while at the same time limiting that kind of spread through those clusters that you described. And also if you've seen similar issues in your population of a reluctance to embrace public health measures, or maybe belief that the virus isn't as severe as we know it can be, and how you've managed that.
Thank you very much, Dr. Hinshaw. And Dr. Oshitani, do you want to respond to that?
Yes, it's very difficult question. And from the beginning, we've been trying to minimize social and economic impact while the maximizing the suppression of the spread of the virus, and which is always challenging. And also in long-term care facilities, you have to balance between the socialization and the prevention of the outbreak in these settings. And so now we are closely monitoring the situation in each the area, and they are adjusting the control measures based on the epidemiological situation. But sometimes the cases suddenly pop up in the different places, which is challenging, and we are still having a risk of the transmission in these long-term care facilities, and but at the same time, we believe that the early response in these settings, both in long-term care facilities and hospitals, if they respond earlier, they can minimize the transmission, and therefore they can minimize the impact, including the mortality impact. And we are now discussing the people in long-term care facilities how best they can respond to the potential outbreak the earlier than before. Thanks.
Thank you very much, Dr. Oshitani. And there are many similarities and some differences that we want to explore more, but unfortunately, our time is very limited today. So I go to the second question, like all countries have responded to this crisis in somewhat different ways, taking the balance between the public health and economy, but this is not just a domestic issue. So in a post-COVID-19 world, what were your views on international collaboration in the field of public health? So Dr. Hinshaw, please.
Thank you. So can I just clarify, in terms of international collaboration in public health, are you thinking about how that intersects with our ability to support each other in economic recovery as well? Or are you thinking it would be more about the technical scientific exchange of how we've not only how we've managed COVID, but how that helps us to be better prepared for some kind of a future event? Is that more what you're asking, just so I'm clear?
Yes, yeah. Yes, I was talking about future pandemics, yeah.
I mean, I think that we are still learning. We have a lot to learn still about COVID and about what responses work best. I think that one of the challenges that, you know, from my little corner of the world and the culture and population that I work with, and seeing what's reported in the media, certainly from places like the US and others, is that, you know, this has been an incredibly difficult situation for every country that's had to respond, and globally, you know, for the World Health Organization to have to lead the response to this, because there are so many things to hold in balance, and when information is incomplete and recommendations and decisions need to be made, in hindsight, we can always see how something might have been done differently, and yet in the moment we have limited information. I think one of the real challenges that we're all collectively going to have to wrestle with is how we and I know the World Health Organization has just put out, I think, a plan for an independent review of COVID. But I think that we will be collectively much more successful if we have a robust international organization like the WHO that is trusted by the majority of the countries in the world and the world's populations. And so I think that we need to be effective at working together across countries, across boundaries, and doing bilateral and small group discussions. But I really think we also need a strong international organization that's using best available evidence to come up with recommendations, to come up with a path forward. And I think that inevitably that organization, as we all have, will make choices that, you know, in hindsight turn out to perhaps not have been ideal at the time, but we all just have to do the best we can with the information we have at the moment we have it. So I think one of our goals going forward, in my opinion, will be to try to find our way forward, to learn the best we can from what went well, what could have been better with international collaboration on COVID, because I think that we have seen pandemics like SARS, like MERS, like Ebola emerge over the last, say, 15 years. We have had several new pathogens, and those are only, of course, just the high profile ones. There have been others as well. And so I don't think we can count on this being a once in 100 years event. I think that we should plan for this to become a more common occurrence. Not that we would wish that, but that we should be prepared for this to be a more common occurrence so that we can continually improve and continually be thinking about how we can be more effective at international collaboration. Does that answer your question?
Thank you very much, Dr. Hinshaw. And do you have any comments, Dr. Oshitani?
Thank you very much for your question. As Dr. Hinshaw mentioned, this is a new virus, and we are still, everybody is still struggling to find the best solution for this virus. And I attended the webinar about 2 weeks ago. The objective of this webinar is to exchange the experiences between the 3 Asian countries, the China, the Republic of Korea, and the Japan. And interestingly, all 3 countries are using quite different approaches. And but all 3 countries are managing to minimize the impact. And I don't think there is a one size fits all type of approach for this virus. And every country is in a different stage of outbreak, and every country has a different the culture and the social backgrounds. But it's still important to share the lessons learned in each country, and also to share the good practices between countries. I was working in WHO Western Pacific Region office during SARS in 2003, and I was responsible officer for the emerging disease at that time. And during SARS, WHO initiated many the networks of public health and physicians, the laboratories, infection prevention and control, and so on. And we actually had the teleconference every day from early morning till midnight. And as you probably know, there was also outbreak in Toronto, Canada. So the teleconference was, they always held at the midnight in Manila time. The Western Pacific Regional Office of WHO is located in Manila. And we didn't have Zoom or the Google Meet at that time. We were just using the telephone, but we managed to exchange the information between WHO and the countries, and also between countries. And WHO is supposed to play more active role in the networking, but unfortunately, WHO is not the active as expected, as Dr. Hinshaw mentioned. But there are many different channels now I also attended the webinar hosted by the president of Albania about 3 weeks ago, and which was not probably possible or feasible 17 years ago. So there are many different channels, and this webinar, hosted by the Prince Takamado, the Japan Center, is also important for us to learn the lessons from our colleagues in Alberta. And this kind of the exchange is important to improve our strategy. And I hope we can have the more and more such opportunity to learn lessons each other. And that's probably the key for the better prepared for the next phase of outbreak, and also the better prepared for the next emerging diseases, as Dr. Hinshaw mentioned. Thank you very much.
Thank you very much for your insights. And do you have any comments or questions for each other?
So I just maybe would have one additional question about you mentioned that even school children know about the 3 C's, and having that kind of popular understanding of what's needed. I'm curious though if you've seen some parts of your population. I think one of the challenges we're facing with an age of social media and our ability to connect quickly and rapidly with each other is a great benefit. It can also be a challenge when there are theories about COVID perhaps being a hoax or not true, or there's various theories that can circulate quite widely. And I'm wondering if you've seen that in your particular population, and if you have, what kinds of measures you've taken to encourage the use of reliable sources of information, or and how much you've used social media as a part of the strategy.
We are also having the same problem. We have many rumors, hoax, and so on. And some the so-called expert recommend the young people to be infected. And that kind of thing is also happening in Japan. But we are trying our best to send the proper messages to the general public. We have the expert panel. Now the expert panel is they changed the name, but we have an expert panel, and the expert panel they send a lot of messages to general public, and we had some problems, but that were quite effective to send the right messages to general public. But of course, there are still many unknowns about this virus, and it's very challenging. We may need to change the messages. The message we sent yesterday may not be true, and so that's the challenge for us. Probably it's the same for you, and so it's quite difficult, but we are still trying our best. And I also have a question to you. And in Alberta, you said the number of cases among young people are increasing, and same pattern is seen in Japan. And it's quite difficult to send right message to young people. And how can you approach to young people? Are you using the social media, or other the tool to send the message to young people?
Yeah, it's a good question. We're trying to use a variety of tools and platforms. So we do have social media campaigns. Our current messaging is really focused on the slogan, "Remember who you're protecting." And so what we're trying to do is to have the message that even though people who are younger and have no chronic conditions are at relatively low risk of severe disease, if they're not careful with either if they are exposed to and get COVID or if they pass it on to someone else, that they can cause someone else to have very severe disease. So we've created a video with Albertans who are well known, so sports players, hockey players, musicians, kind of well-known Albertans who are talking about why it's important to take precautions against COVID, and that even if you don't do it for yourself, you do it for the people that you care about. So thinking about who you would want protected, whether it's your grandmother, your aunt, your cousin who has a chronic condition, and then you protect others the way you would want others to protect the people that you love. So we're trying that. We haven't moved forward on some other potential plans yet, but we are thinking about other ways to try to amplify voices of the general public who have either had an experience with COVID, perhaps, for example, perhaps a younger person who had severe disease, who would be willing to speak publicly about their experience, or younger people who are seeing why this is so important and are taking steps to protect others, and who would be willing to be, again, kind of champions for that message. So we're trying to think of ways to make it not just about official government sources, but how we can try to amplify the message of all of us caring for each other, that we're all in this together, and have that message picked up and carried on by others outside of official sources. We haven't perhaps succeeded as much as we'd like on that, but that's kind of what we're trying right now.
Yeah,
Thank you.
very much. Dr. Oshitani, you want to say something?
No.
Okay, yeah. Thank you very much. Yeah, reaching out to the kids, quite important. I have 2 kids by myself too. So it is a very important topic, I think. But this is a bit beyond your available hours, Dr. Hinshaw. I'm very sorry for go beyond of it. But thank you. Thank you very much for being with us today. Very much appreciated. And thank you very much for the work you are doing for all Albertans. Thank you very much. Very much appreciated.
Well, thank you for the invitation, and I'm sorry I was a little late, so I don't mind going a bit over, but thank you for the chance to learn and to share information. I really appreciate this.
Thank you. Okay, thank you very much. And now I want to invite Sarah Clifford to ask Dr. Oshitani the last question. Sarah, please go ahead.
Hello, and thank you for the lively discussion thus far. It's been very interesting. But Dr. Oshitani, I know you've kind of touched on this beforehand, but my question was regarding the disparity between Japan and Canada's cases. So as you know, Japan confirmed its first case a couple weeks before Canada had. However, Japan's rate of COVID-19 cases is starkly lower than Canada's, even though geographically it is much closer located to the first epicenter of the virus. So do you know offhand what policies did Japan potentially implement that can help explain the success in comparative terms to Canada?
Thank you very much for your question. Actually, the initial outbreak was caused by imported case from China. And we managed to identify the first imported case on the January 15. And by mid-March, that wave was almost under control. Then the second wave started from mid-March, triggered by the imported cases from many different countries, including the US, the European countries, Egypt, and Southeast Asian countries. And the number of imported cases was much bigger than the initial phase. That's why we had the much bigger outbreak in the March to May. But we managed to identify the cases early enough, especially in the first phase. That's probably because of the health system. As you probably know, we have quite good health insurance coverage. Almost everyone can access to the good health care. And that's why we managed to pick up some earlier cases. And that may explain why we are seeing less the number of deaths in Japan. And also we have the quite good the public health center networks in Japan. And there are over 450 public health centers all over Japan. And the public health nurses, the public health nurses are working, over 3,000 public health nurses are working in these public health centers. And they are the ones who are doing the contact tracing and the public health response to COVID-19. And they had the very special training on the public health. And so these the good the clinical network and the good public health network the very important asset in a Japanese response. And there might be some other factors, and we are still trying to understand why there was such difference between Japan and other countries. And but these the factor may contribute to the lower mortality impact in Japan. Thank you.
Thank you very much, Dr. Oshitani, for your wonderful insights. And Consul General, do you have any comments? Are you okay? Okay. So I think its time is already up. So thank you very much for your wonderful participation. And thank you, Oshitani, for your wonderful presentation and all the work you are doing for people in Japan. Thank you, and thank you very much, Consul General, and everybody for joining us. ありがとうございました。